Duopa treatment is enteral suspension of carbidopa-levodopa. So it's the medication that they've been taking for their Parkinson's disease, but we're able to get it right into the jejunum where it's absorbed, so they don't have to take an oral pill every 2 hours. They're able to get it for a 16-hour continuous release through a PEG-J tube.
This portion is the part that goes into the intestine and ends up in the jejunum. This is the tip end that delivers the medication. This is basically the part that's inside. This is the part that's outside here. And this is the part that the patient deals with from here on. This is the pump. And the pump has the computer that's on top, and it has the actual drug in a little pouch underneath. And these things snap on and off. So one of our first patients, Lucinda, is a prime example of the type of person who would benefit from this treatment. She's a young patient, in this case, who has an active life, who would like to enjoy an active life. She has teenage kids. And one of the things one of her objectives was to be able to shop with her kids and, be part of the family, whereas up to this time she's been relegated to sitting in the car waiting for her family to go into the shopping center and come back because she just couldn't make the distance. Well, she has the typical symptoms of Parkinson's disease. She has the shaking, she has the off time, which we describe as just being motor-wise off. They don't move, they're stiff and rigid and tremulous. She herself did not want to go through brain surgery, which was one of the things we offered her. We tried all the medical options. Then this came up in January, and we began using it because it was a well-studied treatment.
This kind of gives our Parkinson's patients another outlet. Before we just had the oral medications and really the deep brain stimulation, which is a great therapy too, but we have to pick the right patient. So this kind of opens that door up a little.
Yeah, she's had the outcome that we had hoped. She's had the outcome that she had hoped because now she's doing the things that she couldn't do for about 4 or 5 years.
Yes, I've been able to drive to Walmart, me and my daughter by ourselves, and to Battlefield Mall, which I haven't been able to do in like 3 to 4 years now, and shop all day and drive back home to ourselves, cook dinner, do laundry, enjoy my everyday activities now. That's
just very heartwarming to know that we can offer something that really is relatively simple to do, but amazingly important in a person's life.